Hi, I'm Dr. Stan Steindl. I talk a lot about compassion, but isn't it just a nice idea? Something warm and fuzzy, but not very practical? No. Compassion is really helpful in lots of practical ways, and there's plenty of very recent scientific evidence that supports this claim. In fact, learning how to cultivate compassion through an approach like compassion-focused therapy can have profoundly positive effects on mental health. So in today's video, I'm going to give you 5 evidence-based benefits of compassion-focused therapy. There are other benefits, but let's start with 5. Before we get started, let me do a brief preamble of terms and so on. Compassion is a sensitivity to suffering in self and others with a commitment to try to alleviate and prevent it. Compassion is considered to flow in 3 directions: compassion for others, receiving compassion from others, and compassion for oneself, or self-compassion. It's important to help people cultivate compassion across the 3 flows. However, certain fears, blocks, and resistances to compassion can also be present across the 3 flows, and a big part of CFT is working with these fears to allow compassion then rather naturally be expressed and received. Compassion-focused therapy is an evolutionary-based approach to psychotherapy, but when we talk about CFT, we're often including compassionate mind training, or CMT, which is the psychoeducation and skills development component of CFT. CFT often involves more detailed assessment and case formulation, and can be offered individually or in groups. CMT is more of a set course and can be offered as a standalone intervention, often in a group. As a therapist, I have a particular bent towards compassion-focused therapy, but I do want to acknowledge that there is wonderful evidence emerging about the benefits of cultivating compassion and self-compassion across various approaches, such as mindful self-compassion, compassion cultivation training, loving kindness meditation, and compassion meditation. Last quick point is that the evidence is still emerging. In fact, it's exciting times in the science of compassion, self-compassion, and certainly CFT. Lots of studies are underway around the world, but the evidence base already is very persuasive. So here goes: 5 evidence-based benefits of CFT. 1. CFT helps reduce self-criticism, worry, and rumination. CFT was developed to reduce self-criticism, which is the tendency to set unrealistically high standards for oneself and adopt a punitive stance when these standards are not met. Paul Gilbert and Chris Irons described working with self-criticism via CFT in their 2005 chapter, Focused Therapies and Compassionate Mind Training for Shame and Self-Attacking, in the book Compassion: Conceptualizations, Research, and Use in Psychotherapy. By the way, I'll include the links to any references I mention in the description below. An early meta-analysis by Leaviss and Uttley in 2012 found that CFT was in fact particularly helpful for people who are high in self-criticism. But compassion is important for worry and rumination too. Worry involves repeated anticipatory thoughts of potential future threats and imagined catastrophes. Rumination involves persistent and recurring intrusive thoughts, pondering the causes, meanings, and consequences of the distress without actively problem-solving or changing the circumstances. A 2021 paper by Lara Gama, myself, Marcella Matos, and Mark Boschen found that having high fears of being compassionate towards oneself and/or receiving compassion from others increased the effect of self-criticism, worry, and rumination on depression. So it seems that cultivating compassion and self-compassion and reducing fears of compassion is very helpful for managing the effect of repetitive negative thinking styles. Number 2, CFT helps improve depression, anxiety and stress, as well as other mental health problems. Of course, the relationship between self-criticism and depression is well established, and depression itself is a widespread and often debilitating condition. Self-criticism, worry and rumination all seem related to depression and anxiety and stress as well. But compassion and self-compassion help. James Kirby, Cassie Tellegen and I published a meta-analysis in 2017 that found that compassion-based interventions produced significant improvements in self-compassion and mindfulness, but importantly also significant improvements in anxiety, depression, psychological distress and overall well-being. A 2021 systematic review by Craig, Hiskey and Spector found that CFT shows promise in conditions with underlying shame and self-criticism. Of course, many forms of psychological distress do involve underlying shame and self-criticism. And they found encouraging results across severe and complex mental health problems, such as depression, but also forensic populations, eating disorder populations, and people diagnosed with personality disorders. Number 3, CFT helps reduce shame. Whenever trials are carried out to test the effectiveness of CFT, shame is measured. And the Craig et al. 2021 systematic review highlights several trials that have demonstrated reductions in shame following CFT. A 2021 study by Marcella Matos and colleagues found that participating in a Compassionate Mind training course led to reductions in self-criticism and shame by increasing participants' self-compassion, increasing their openness to receiving compassion from others, and by reducing participants' fears of self-compassion and fears of compassion from others. CFT and CMT work very well with shame. If you're interested, Marcella and I published a single case study in 2020 called You Are Already All You Need to Be, a case illustration of compassion-focused therapy for shame and perfectionism in the Journal of Clinical Psychology that outlined a CFT assessment, formulation and treatment plan for working with shame and perfectionism. Number 4, compassion helps reduce body weight shame. One type of shame that's been receiving particular research attention over recent years is that of body weight shame. People who have bigger bodies often experience body weight shame and are at risk of mental health vulnerabilities such as depression and anxiety. In fact, lots of people experience shame related to their bodies, and this can be a major source of suffering. Alicia Carter and her colleagues published a pilot trial of compassion-focused therapy for body weight shame in 2020, showing that CFT increased compassion and helped reduce body weight shame. One of the interesting qualitative findings in this study was just how helpful the group process was in de-shaming participants' body image. So group CFT is often a great way to go. This was a pilot study, but the results of a follow-up randomized controlled trial that I was very fortunate to be involved with as a group facilitator has been submitted for review. The study had some fascinating results, so stay tuned for that. Number 5, compassion helps with trauma and reducing post-traumatic stress. Cultivating compassion across the 3 flows is very helpful for people who've experienced trauma. It seems particularly important to develop one's competencies around self-compassion and being open to receiving compassion from others. Ashfield and her colleagues published a qualitative study in 2021 that concluded that group CFT is particularly helpful, with the interrelationships in a group helping to shift self-perceptions, especially around trauma and shame. They also found that CFT's psychoeducation had a profound effect through helping people develop an understanding of themselves, their experiences, and their difficulties. And finally, participants highlighted the importance of developing compassion for others and themselves to aid them in safely accessing their emotions. 2 more pilot trials I've collaborated on have involved group CFT with combat veterans diagnosed with posttraumatic stress disorder, led by Maddie Ruminuk, and group CFT with adult female survivors of childhood sexual abuse, led by Lisa McLean. Both studies are making their way through the peer review process at the moment, and I really can't wait to share more details of the studies and their findings. In both cases, CFT was very helpful in reducing PTSD symptoms and shame. The evidence base around the mental health benefits of CFT is growing fast. While more is needed, compassion-focused therapy and compassionate mind training delivered individually or as a group help reduce self-criticism, worry and rumination, depression, anxiety and other psychological distress, shame and in particular body weight shame, and trauma or post-traumatic stress. There's a lot of exciting work happening in the field of compassion and mental health, trialling CFT in a whole range of populations. So keep watching this space. And thanks for watching this video. Thank you to everyone who watches, likes or subscribes. It means a lot and helps me get the word out there about compassion, self-compassion, compassion-focused therapy, and living a compassionate life.